Welcome back to the show. March marks Colorectal Cancer Awareness Month, and in recognition, Queens Medical Associates is implementing a community outreach program to educate the public on the disease, signs to look for, new screening tools, and available treatment. Dr. Abhisek Swaika is a triple board certified hematologist and medical oncologist. He joins me now in studio to talk about it. Doctor, thanks for being here.
Thank you for having me.
So we talk about colon cancer a lot. We hear about it a lot, but for our viewers who don't know, what is it? How common is it?
Colorectal cancer, excluding the skin cancers, is the third most common cancer to be diagnosed in the United States. On an average, the American Cancer Society predict that 100,000 new cases of colon cancer and around 50,000 cases of rectal cancer will be diagnosed this year in 2018.
So it's something that we certainly need to keep an eye on. But I guess for some of the patients, some of the viewers, the concern is that they start feeling symptoms and maybe it's something else. Maybe they're overreacting. What are those signs and symptoms, though, that they really should be looking out for and seriously considering to visit their doctor?
Well, changes in bowel habits, so for alternating constipation or diarrhea, narrowing of the stool for a few days, abnormal weight loss, fatigue, and then symptoms like blood in stool. Those are really concerning. Now, understandably, that these are also seen in other diagnoses like irritable bowel syndrome, inflammatory bowel disease, or even hemorrhoids. But then if this becomes prevalent, then they need to be seen by the doctors.
So I guess really if you have any of those symptoms, it might not be cancer, hopefully it's not, but at least go get yourself checked.
Absolutely.
So, and some good news, I mean, it all sounds scary, but the death rate for this has been falling, but it's so important to get checked at the right time, the right age. What do you recommend? What's the cap at how late people should be putting this off to really get checked?
Well, the national guidelines are to be checked at around age 50. Now, again, these are for low and average risk patients, but then there is a subset of high-risk patients who need to be screened earlier.
So who qualifies as a high-risk patient then?
So definitely patients who have high family history, risky family history in terms of having someone as their first-degree relative, so parents, siblings with cancer, or polyps, those are the ones who are really at high risk. The others ones are with overweight, obesity, and high-risk factors like smoking, heavy alcohol consumption, but they need to talk to the doctors again, and any symptoms which bother them should be having this test and seeing the doctor.
So in that case, if they're high risk, what's the age that you recommend, or is that on a case-by-case basis?
It is on a case-by-case basis. For example, if someone's dad had a cancer at age 50, they need to start 10 years prior, so they would need the colonoscopy at age 40.
It's difficult, too, to put your finger on because we have these guidelines and they're helpful and they're right on the mark for the most part. But sometimes you hear about people who they had no family history and they were diagnosed. I mean, our very own anchor here, one of them, Roma Tori, she was diagnosed. She didn't get it right when she was 50. She waited a few years, but she had no family history. She ate well, so she really thought that she was clear from this, and it was highly unlikely that this would happen. I mean, do we know why this happens to people?
So it's a heterogeneous disease. Definitely there are some modifiable risk factors and some which you cannot control. The modifiable risk factors include the diet, but as you mentioned, so high fiber diets is something which is preventive. On the other hand, diet with it more in processed food and red meat is increased risk of colorectal cancer, including smoking, heavy alcohol consumption. Some things which you cannot modify are age, so advancing age, and hence for the age 50 for screening, or also some genetic risk factors which you inherit from your parents.
I'm glad you're bringing this up because personally I come from, well, half of my family, they're very afraid of doctors. You know, they want to avoid it at all costs. If they're feeling okay, they are not going to the doctor. And I think it's a valid point, though, that people, especially the idea of a colonoscopy, I mean, it sounds very invasive. People hear about complications happening with it that scare them even more. So what is your advice to patients like that?
Well, I think it's now proven that the screening not only detects the cancer earlier, but also prevents it from happening. So for example, if you have polyps which can be removed, and that takes care of and not having cancer as an incidence. On the other hand, there are other options which you could discuss with your doctors to see if you want to have screening. So a new FDA test called the stool DNA test was approved in 2014, which checks your stool kit, which actually they send you a kit at home. So privacy of your home, you get that done and you send the sample. But again, you have to discuss with your doctor and the risk factors of if you are low, average, or high risk to get those screening
Right, so at
methods.
least it's an option though. Maybe not for everyone, but it's an option that seems maybe a little bit more private, a little bit less invasive, and can give you an indication of whether or not you're susceptible to this. But there are treatments available. If you don't catch it in time, what can patients expect here?
So it depends on what stage colorectal cancer you get diagnosed with. Again, if you're in a polyp state, which is not cancer, then it can be completely cured. Early stage colorectal cancer can also be cured depending on stage 1, 2, and 3. This involves techniques in surgery and chemotherapy. But unfortunately, if you are diagnosed with stage 4 or metastatic extensive stage, then the prognosis is poor, but newer research options, including chemotherapy, targeted options, immunotherapy, and further research is helping have patients live longer.
And especially in a month like this, I know it's your mission and several of your colleagues to get the word out about this. So how were you educating people during this month?
Well, first of all, I want to give a shout out and applaud our primary care physicians here and gastroenterologists in Queens who encourage patients to go and get the screening done. But from Queens Medical Associates, we have broadcastings, we do online websites and programs like this where we have the awareness spread out to patients.
Perfect. So we hope people will go visit it and get all this information they need because, as you said, preventable in so many ways if you catch it early enough. Hopefully this message will really resonate. Thank you, Doctor, for coming in.
Thank you.
When we return, we're going to have more straight ahead here in the Queens Week in Review, including a look at an inspirational film you're not going to want to miss. It's based right here in the borough. We'll be right back.